Hello everyone. Today we are going to see about limb ischemia, that is a peripheral vascular disease. It is going to be presented by Ponusami Duton, Wellington Newton Wells, Rajendran Karthik and Muhammad Musa Muhammad
A
Asif.
58-year-old man presents to the emergency room with a severe pain and numbness of his left foot. He has angina and a carotid root suggesting systemic atherosclerotic disease. He previously had symptoms of bilateral cleft claudication, but now he has sudden onset of pain, pallor, and numbness, pulselessness in the left foot. The differential diagnosis was acute limb ischemia, deep venous thrombosis, ankle injury, soft tissue, peripheral vascular injuries, and superficial thrombophlebitis. Most likely diagnosis is acute limb ischemia. It's either thrombotic arterial occlusion or embolism from a more proximal source. The most common symptoms associated with the chronic artery insufficiency caused by peripheral artery disease is intermittent claudication. It is ischemic pain and occurs distal to the site of the arterial stenosis, most commonly in the calves. Severe occlusion may produce wrist pain. The important risk factors are cigarette smoking, diabetes mellitus, hypertension, dyslipidemia, and elevated homocysteine levels.
The physical examinations includes the palpation of the peripheral pulses, and it gives the diminished or absent below the level of occlusion, and the bruits may indicate the accelerated blood flow velocity and the turbulence at the site of the stenosis. And then comes the clinical approach. Although atherosclerosis is a systemic disease, clinicians often focus on the coronary circulation and are less alternative to the extremities. Yet, the atherosclerotic peripheral artery disease, that is a PAD, is estimated to affect the 60% of the Americans, that is age of 55 years and older, and it exists without clinically recognized the coronary or cerebrovascular disease. The PAD confers the same risk of CAD death as in persons with prior MI or stroke. And the elevation of the feet above the level of the heart in the supine patient often induces the pallor in the soles, and the chronic arterial insufficiency occurs, and the severe ischemia may produce ulcers or gangrene. And if the legs are placed in the dependent position, they are frequently they develop a rubber, and as a result of reactive hyperemia, and in the chronic arterial insufficiency, it may cause the hair loss on legs and feet, and thickened and brittle toenails and shiny atrophic skin. Next is when PAD is suspected, the test most commonly used to evaluate for arterial insufficiency is the ABI, which is the ankle brachial index. That the systolic blood pressures are measured by Doppler ultrasonography in each term, and the dorsalis pedis and the posterior tibial arteries in each ankle. Normally, blood pressure in the large arteries of the legs and arms are similar. In fact, the blood pressure in the legs often are higher than in arms because of the artifact on measurement. The normal ratio of the ankle to brachial pressure is more than 1, and in the patients with claudication, they have the ABI values ranging from 0.41 to 0.90, and those with critical leg ischemia have ABI values have less than or equal to 0.40. And further evaluation with the exercise treadmill testing can clarify the diagnosis, and when symptoms are equivocal, can allow for assessment of functional limitation, example like maximal walking distance, and can evaluate for concomitant coronary artery disease.
Critical leg ischemia. The patient with a critical leg ischemia is 0.440 severe, which disabling claudication, rest pain, and non-healing ulcers should be evaluated. This can be accomplished by percussion angioplasty and interosseous stents and surgical bypass grafting. It will be done without replacement. Next, Buerger disease. In this, we are chronic peripheral arterial insufficiency include thrombogenesis, which inflammatory conditions, smells or medium size arteries that may affect upper and the lower extremity, first exclusive for smokers, and which mostly affected by males younger than 40 years. Then fiber muscular dysplasia. Fiber muscular dysplasia is affected a medium and small arteries that usually occurs in women, which clinical symptoms are atherosclerotic PAD. And next we are going to see Taxosa arthritis, inflammatory condition which seen in primarily in younger women that affect aorta, most commonly subclavian arteries, and claudication and Ryan phenomenon, which constituent symptoms are fever and weight loss. Then acute arterial occlusion. In this, the patients which peripheral arterial insufficiency who presents with sudden unremitting pain and have acute arterial occlusion, most commonly result in embolism. Most commonly. Then here is a fibromuscular dysplasia here. Then arterial occlusion emergency. Arterial occlusion emergency. In this, the patient which number of signs which called 6px, pain, pallor, pulseness, paresthesia, poikilothymia, and paralysis. The first 5 signs are fairly quickly with the acute ischemia. Paralysis will develop if the arterial occlusion is severe and persistent. Thank you.
Hello, I'm Mohammad Asim. Now we are going to discuss about the management of this case. The management of this case is the goal of the therapy include the cardiovascular morbidity and the mortality. Improvement in the quality of life by decreasing symptoms of clarification and elimination rest pain and prevention of limb viability. And in this case, the major management is smoking is the single important risk factor importing both graduation symptoms and overall cardiovascular mortality. So now coming to, as mentioned here, the non-fatal myocardial infarction is terminated by the smoking as much as 50%, more than any other medical or surgical intervention. So now, please next slide. Now coming to the next slide, it's the medical management. Like the medical management such as aspirin and clopidogrel all have been shown to improve cardiovascular health and may have an effect on peripheral articular circulation. Now, carefully supervised exercise programs can improve muscle strength and prolong walking distance by promoting and development of peripheral blood flow in our body. And then coming to next things, it's like clostazole, a phosphodiesterase inhibitor with vasodilator and antiplatelet properties, has been approved by the Food and Drug Administration for the treatment of claudication. Now going to the next, surgical restoration of the artery supply is mandatory in patients with an acute arterial occlusion that threatens limb viability. Initial management includes anticoagulation with heparin to prevent propagation of the thrombus. The affected limb should be placed below the horizontal plane without the pressure applied to it. And the conventional arteriography usually is indicated to identify the location of the occlusion and to evaluate potential methods of revascularization. Surgical removal of embolus or arterial bypass may be performed, particularly in a large proximal artery is occluded. A balloon catheter may also be attempted to remove the clot. Alternatively, a catheter can be used to deliver intra-arterial thrombolytic and in comparison therapy directly into the thrombus. In comparison with systematic fibrinolytic therapy, localized infusion is associated and fewer bleeding complications. That's it. Thank you.